So the next thing that we're going to talk about, again, separate from those diagnoses, would be if you're actually passing out, if you're having syncope, what types of syncope are we dealing with, and how would we know the difference between them? So those three, like I said, were vasovagal syncope. We have neurocardiogenic syncope, also cardioinhibitory syncope, and then we have vasodepressor syncope. So Dana, you want to talk a little bit about the differences in those?
Yep. So we'll just get into real quick kind of nitty gritty when we talk about the objective findings that we're looking at for these types of conditions. So for vasovagal syncope, what we're finding is upon testing, you're having both a drop in your heart rate and your blood pressure. When you have the vasodepressor syncope, similar to orthostatic hypotension, your blood pressure is dropping, but in orthostatic hypotension, you are changing positions and your blood pressure is plummeting immediately. When we run diagnostic testing and we're looking at this, people who have vasovagal syncope, their blood pressure is normal, and then it slowly starts to drop down. Right. So in those patients, they have a little bit more warning, a little bit more time. Whereas those patients with orthostatic hypotension, if they're passing out, they're the ones that are waking up on the floor. Same thing with neurocardiogenic or cardioinhibitory syncope, their heart rate's just dropping. And so they're waking up on the floor, right? So some of you guys might be experiencing these different types of syncope. But again, it's a very umbrella term. It's just syncope. We're passing out, we're losing consciousness. But in order to get the appropriate treatment, whether that treatment is medication, whether you're making nutritional changes, whether you go to see a functional neurologist, right? It's important to understand where is that mechanism of dysfunction in the brain? Like where is that even happening, right? Because they're all not created equal, which means that they all deserve their own one, diagnosis, and two, specific treatment for those types of conditions.
Yeah, I would agree. But also sometimes that can be difficult to find out because one, you do have to go through a full tilt table test. A lot of times you may not pass out during the test. So finding out the exact type of syncope that you have can be a little bit challenging unless it happens right at the time of testing. The big thing is that we know that system is failing, that you're not able to maintain that adequate amount of blood flow to the point of lights out. And that is very different.
Well, I would say on a functional neurological evaluation though, right? Or if somebody brought us their tilt table test, and even though they maybe didn't pass out on their tilt table test, we would probably see the discrepancy there, right? Like it may not have been great enough in the moment for them to have a syncopal episode, but you're going to see those fluctuations in the vitals too. So it gives us at least some indication into the system, like, I think this is more related to your heart rate than it is to your blood pressure. Because you were starting to get that pre-syncope episode, but your blood pressure was maintaining, what we would have expected and things like that.
Yes, of course. And what I was going to say is that it's a very different issue that we're looking at from our perspective, I would say, if someone is passing out versus if they're not passing out. So that's kind of step one to say, are you passing out or are you not? How significant is the failure in that system? And that gives us a lot of information in the first place, whether we actually have all of the criteria or the ability for somebody to get officially tested and to be able to see those things.